Welcome to LungML. LungML is an application that allows images of pulmonary chest X-rays and MRI scans to be used to detect if a patient has manifestations of lung cancer or lung disease using computer vision and machine learning powered by TensorFlow. It enables the accessibility of accurate diagnosis of a patient for maximum accuracy and reliability, as well as serve as a second pair of eyes for medical practitioners in their own diagnoses of a patient. As an app additionally created for third world countries and rural areas, it is also for individuals who do not have access to medical support or fast and efficient examination. LungML is designed to be used frequently to evaluate the severity of pulmonary conditions and to provide users with knowledge of their own or their patients' current health. The overarching idea was sparked by the infamous fight against lung cancer and lung disease. Not only have such maladies killed millions of individuals worldwide, but they have also indirectly harmed our collective well-being as a species. Indeed, physicians can only identify the risk of lung disease with a bewildering 30% accuracy, despite lung-related illnesses being responsible for millions of deaths annually. Not to mention, lung cancer is the leading cause of death among all types of cancer. Despite acquiring over 4 million cases per year and occurring with the subtlest of symptoms that, in reality, require immediate medical attention, most patients simply cannot access the help they need. Lung disease is a serious malady that primarily affects your lungs. For instance, the bacteria that cause tuberculosis are spread from one person to another. Tuberculosis is presently one of the top 10 causes of death and the leading case from a single infectious agent, greater than HIV. In 2019, approximately 10 million people acquired tuberculosis worldwide, resulting in a multitude of deaths caused by poor diagnoses of the disease. If tuberculosis can be identified, it can be easily treated with the use of antibiotics, but without a proper diagnosis by medical practitioners, there are a plethora of unnecessary deaths happening every year due to such a disease. My youngest sister, Sophie, was recently diagnosed with stage 4 lung cancer. The issue was that the disease was not properly diagnosed by the doctors once it had begun, and her condition was left untreated for months. Had she been properly diagnosed prior, would she have gotten the necessary medical treatment to handle the disease, and she could have avoided escalating to stage 4 cancer. As a result, LungML noticed the urgency for a reliable, convenient, and accurate mechanism to correctly diagnose patients who potentially suffer from pulmonary illnesses. Striving to change these ongoing predicaments and to allow people to become informed about their health consistently, easily, and effectively, LungML was created. In navigating to the page titled "What can LungML do?", users are given a description of the application and its utilities, as well as context of LungML's objective and mission. Returning to the main page and navigating to My Diagnosis, users can upload a custom image, whether this be an MRI scan or an X-ray image, and in doing so their selected image is displayed to assure they've selected the correct one. By pressing Diagnose, their results are subsequently displayed. The results will always include the percentage accuracy of the machine learning model with the specific image, to enable the user to remain aware of the reliability of the diagnosis with this particular selected image. The machine learning model was created using TensorFlow, and then was converted into a TensorFlow.js model. When the user clicks on the Diagnose button, the request is sent to the backend server, which calls the model with all its weights and factors, and then takes the input image and diagnoses whether or not the patient has pulmonary disease or cancer. The front end was made using HTML, CSS, and JavaScript, and the server-side programming was created using Node.js. Future endeavors for LungML include scalability, as well as deployment of the model on a cloud service such as Google Cloud. This would increase client-side performance. Additionally, future plans include the creation of a database of all the images the users upload, and passing those images through a data pipeline for pre-processing the images. Afterwards, saving those images from the user into a dataset for the model to train on weekly. This allows the model to be up-to-date and constantly improving, especially in terms of its accuracy and ability in reducing bias due to the large variety of unique X-ray images. In addition, expanding the use case of LungML to other medical conditions like cardiovascular diseases and brain tumors by implementing more models.